2.
Good afternoon. My name is Dr. Carrie Sequeira, and it's a pleasure to share space with each one of you today. As we get settled and members join, please take a moment to introduce yourself in the chat, write your name, your title, and the organization you represent. We will start at 2:05.
Thank you, everybody, for joining us today. If we could advance to the next slide, please. Before we begin, we wanted everyone to take just a moment to look at the slide we have up here and to really recognize where you're at as we begin their webinar. This presentation includes discussions related to loss, suicide attempts, and lived experiences with mental health challenges. We are individuals with personal experiences, including loss and survival. We really want to remind you to please prioritize your well-being, take breaks or step away if needed during or after the presentation. We've also included in the bottom of the slide you see there, the text line for National Suicide Prevention, as well as the 988 hotline. Again, welcome, and we look forward to having you with us today.
Thank you very much, Dr. Boyer. I appreciate that. So next, welcome. My name is Dr. Carrie Sequeira, and I'm the administrator with the Office of School-Based Health Programs under the Whole Child Division, a division that was created by our Superintendent Thurmond to ensure we were meeting the needs of the whole child. Thank you, Superintendent Thurmond, for your leadership. I am very happy to see so many LEAs present here today to learn and support our students as we recognize Suicide Prevention Month and join us for our webinar, Together in Conversation, Together in Hope. And we know in our school communities and in our office, it's not just a single month. that we want to make sure that we're providing resources and support for our school communities. I would be amiss if I did not provide accolades and appreciation to Dr. Mary Beth Boyer for her leadership on this webinar. We will learn to recognize warning signs, engage in supportive, stigma-free conversations, and create a connected, caring environment that promotes student well-being and early intervention. Together in conversation, together in hope. Our objectives today include increase awareness and understanding, equip school communities with the knowledge of risk factors, warning signs, and protective factors related to youth suicide. Strengthen communities too, strengthen communication and intervention skills, build confidence in initiating supportive, stigma-free conversation with students, faculty, staff, and families. Foster a culture of connection and support. Promote school-wide strategies to encourage connection, well-being, and early intervention. Remember, every child is one caring adult away from changing their narrative. Be that one caring adult. I have the pleasure to introduce a phenom, Heather Newmar from the San Diego County Office of Education, that really leads the way in the work in this area. Heather has her Master's of Arts in Sociological Practice, is coordinator of the Student Wellness and School Culture for the San Diego County Office of Education. Ms. Moore is a subject matter expert in suicide prevention and school mental health, providing training, technical assistance, and coaching to districts and schools across San Diego County and California. She leads initiatives and advocacy efforts to help shape protocols and practices that prioritize suicide prevention and mental health in K-12 schools. Heather, would you please join me up here?
Thank you, Carrie. Appreciate you and everyone here on the call. So happy to be here. San Diego County Office of Education, our Student Wellness and School Culture Department really thrives, not thrive, well, we thrive. We strive to create resources around mental health and suicide prevention to support all students in our state. Here in San Diego, we don't care about zip codes. We care about all students. So hopefully the resources I'm sharing with you today are helpful for your school communities. And so I'm going to share two of many guides that we create and update each school year. And I'm going to start off with the first one, which is, thank you, our Suicide Prevention Resource Guide for elementary schools. So suicide prevention in elementary schools is really a newer phenomena, and there is legislation, AB 1767, that now requires, just like middle and high schools, elementary schools also now have to create suicide prevention policies that include prevention, intervention, and postvention. So when this legislation passed, many of our LEAs in San Diego County were reaching out saying, what does this even look like in elementary school? What kind of trainings are we supposed to do and curriculum and so forth? So over the years, our team has researched and vetted what we feel are the best of what's out there to support elementary schools meet these legislative requirements. We know that conducting suicide risk screenings is now common practice in elementary. And I will tell you, in San Diego County, we track the number of suicide risk screenings that are done in our schools. And I can tell you, they are much more prominent in elementary school than they are in high school. Our young kids, it's starting so much younger. So it's so important for us to really lift up suicide prevention in elementary schools. So hopefully this guide is just the beginning of a start to be able to do more of this work at this level. So I am going to ask Tiffany to open up the link just so I can walk you through really quick how it is laid out. This really is designed for busy school administrators to not have to sift through all the guides and resources out there and just have at their fingertips, what do I need to know? That's what they tell us, and we create and deliver. So just very briefly, what is 1767 and how to use the guide? And so if you can go down one more, I'm going to show you the two broken up areas. One is suicide prevention training for staff. So in the blue-green section, just everything we have been able to find that can be used to train our elementary school staff in suicide prevention. It's broken down by the training with the link, the description, the format, length, and cost. And then if you could please scroll down to the orange yellow section. Thank you so much. This is really curriculum and programming that is relevant and age appropriate for elementary schools. So you can see the different links to get the information. Is there a cost to it? The format and the description. So a couple things I want to highlight here in this. If you can go to the next page, I think there's more. Something that we're starting to see more and more of is, which is a great thing, is peer-to-peer programming. Because when we talk to youth across the state, in our county, they often say they prefer to get help from their peers. Adults are great, but they prefer help from their peers. So really lifting up peer support. In San Diego County, we have implemented Sources of Strength and Hope Squad to suicide prevention peer programming. It's unique because it's elementary, middle, and high, where much of the stuff out there is for high school. So those programs have really done a fabulous job in our schools to really have the students become the ambassadors and champions around suicide prevention in their school communities. Always happy to share any information on that if anyone wants to learn more. We are presenting at Wellness Together conference this month on these two peer-to-peer programs, and we're bringing students to tell the audiences, not us, the impact it's had on the schools. So with that, I'm going to take us back to our slides and show you one more resource that we'd like to share. This suicide prevention resource guide for K-12 schools was created pre-COVID because so many of our schools and districts have reached out and said, I'm busy. I can't navigate all the information out there. What do I need to know about implementing these legislations in our school around prevention, intervention, postvention? So to be responsive to that, we have created a guide and we update it every year because things are constantly moving, changing, and evolving. So this guide is really just meant to be able to help our schools have that information at their fingertips and really be able to have high quality local, state, and national resources to support schools in building comprehensive protocols and practices. This guide is broken down by local and state resources and national resources. I will say there's a handful of San Diego resources in there, but overall, most everything in this guide is designed to be used statewide. One new thing with the guide this year, it's a digital guide, but we have added QR codes for every resource, so it can also become printed out, a printed guide, and use the QR links. So now I'm going to ask if we could open up the guide, and I'm just going to walk you through how it's laid out and how to access it. So if you go, thank you. If you go to the table of contents, you can see here, these are the different sections that are included. And we always start with state legislation because we want to make sure we're making the connections between all of these resources here and how it can help not only meet the requirements of legislation, but also really inform best practices in the field. Okay, so if you can go to the first page where it is, thank you, state legislation. So this page, I just want to highlight here. Every year we update it. If there's new legislations, we add it. And when you look at it, the legislations, you can see it just kind of breaks it down in a simple way for our school administrators to be able to digest. If you go to the bottom of the state legislation page, there is a, can you go a little bit more down? Thank you. No, I'm not seeing it. Can you go back up? I'm sorry. It's hard because I'm not navigating this. I'm sorry. If you can go up further. there should be quick guide. I'm sorry, it's on the top. We moved it. So if you can click on this quick guide on the top left, thank you so much. It's hard to keep all of the legislation around suicide prevention and mental health in the top of our forefront. And so this is just a quick guide, and I want to show it to you because this is one of many guides that we create. When you look at the legislation, it breaks it down. What is it required by the school to do, best practices, and then the resources. So you can see on the right, we have many different resources, not just ours, but others that help LEAs meet each of the requirements. So if you want to look through, there's many other guides in there that I'm not highlighting today that really are designed, again, to be used across the state. So thank you for that. All right, and so if we can go back to the guide, I will just kind of walk you through each of the sections. So if we can go to the first section, you will see it's school support for suicide prevention, intervention, and postvention. So anything to do with supporting districts to meet those three areas, you will find in this section. And you can see on the top, it's local and state. We got the QR codes. If there is a cost to anything, you'll see a dollar symbol on it. And if you can scroll down, please, to the next page. And there are more resources here. And then if we can go down another page, this is our training. So pretty much anything we know about training for schools in prevention, intervention, postvention, you can find it here. And if you can scroll to the next section, and that's the national trainings. And then student education. So again, so important for us to build the mental health literacy of our students because they are ready and willing to be able to help other students to really lift up mental health and suicide prevention. So various ways we can do that through training and Never Bother campaign. If you can keep scrolling, they're directing change, which you're going to hear more about, and then the national resources. And I was talking about the peer programming. So again, you'll see that here, some of those peer programming, the sources of strength, team mental health first aid. And if you can keep scrolling down, peer-to-peer education. Oops. Oh no. I think we're printing. Peer-to-peer education. So that will give you some of the mental health clubs and again, more of the programming for schools. And if you can keep scrolling down one more page, we have parent education and support. And it's so important that us parents have the same information, tools, and resources as schools do. So just compiling everything we have here for parents to be able to share with them how to keep their kids safe and supported in the home. Next section, please, if you scroll down. And we have quotes, different quotes in there, apps that are free and available to really support suicide prevention. And then the next page, I think, has the crisis lines. Yes. And then the next page has the warm lines, support lines that are available. And then I think there might be one more page. Nope, that's it, the national lines. And that is it. So just wanted to walk you through that. Please know it's all there for you, updated, all the links work. And if there are things missing, we're always open to feedback that we can include in next year's guide. So really appreciate this opportunity to share this information. And if you go to the next slide, I think I have my contact information, as well as a link to our suicide prevention webpage, because it's broken down resources for schools and districts, for students, for families, and being able to just tap into whatever you may need. So thank you so much for your time and appreciate you all.
Thank you so much. As always, Heather, thank you so much. It's wonderful information. If you wouldn't mind dropping in the links to your web pages, that would be wonderful. We tried to do that, but I want to make sure we're staying current with it, and just thank you for the work you're doing for our students because it's helping everyone. And I'm so glad I had the pleasure of meeting you. Thank you. Okay. All right, so now I have the honor of introducing Stan Collins. He is a suicide prevention specialist. He's the director at Youth Creating Change, Directing Change. Stan Collins has worked in the suicide prevention field for more than 2 decades since losing a friend to death by suicide in high school. He utilizes experience to support and develop strategies to create system-level changes around suicide prevention. Stan is the co-founder of Youth Creating Change and a member of the California Department of Education's Student Mental Health Policy Work Group. So Stan's going to talk about postvention today. So Stan, do you want to come join me?
Yeah, thank you, Carrie. Can you hear me okay?
Yeah, I can hear you. Thank you.
Okay, great. Hey, everybody. Thank you for being here. And thanks for all the work you do. Again, my name is Stan Collins from Youth Creating Change. And as mentioned, I'm a survivor of suicide loss. So I want to start first and foremost to remind everybody of the opening slide, which is throughout, especially my presentation, but through this whole presentation, and take care of yourself. We need you here tomorrow. So I'm going to do my best to avoid any activating content. But I understand you might be at work and thinking everything's good, and all of a sudden something comes and kicks you in the gut. So when they talked about the National Lifeline, crisis text line, after this training or this webinar, if you need to call and reach out and just to kind of decompress, please take care of yourself. So with that, I also want to say thank you to CDE for allowing us to highlight, or allowing me to highlight, postvention. I think of all the areas of, from prevention, intervention, postvention, we oftentimes put postvention at the end of the conversation, and it kind of gets neglected. And I would suggest postvention is one of the biggest gaps that many of our schools and districts and LEAs across the state are experiencing. So first off, let's cut through the jargon. What is postvention? Postvention is the response, interventions, programs that occur after a death by suicide. Now, oftentimes we only associate this to a student, but I would want to propose it also includes death by suicide to a staff or a prominent member of in the community. It could be a coach, a mentor, or just a prominent figure. Postvention considerations. Most importantly, timing is critical. One of the things that breaks my heart the most is when I get contacted 2 or 3 weeks after a suicide has occurred. And by then, so much trauma and damage has been incurred on the students and the community as a whole. So that leads to the second point, which is that for us to be effective in the postvention setting, we really need to have a plan in place now, like before. And it would be great to cross our fingers and hope this never happens. But if we know that suicide is, the second or third leading cause of death for youth in most counties across the state, we have to account for that. And the analogy I would, suggest is, how many of you have been part of a fire drill? And how many of you have actually been part, at a school when a fire happens? And I'm not saying we shouldn't do fire drills. I'm just saying if one of the more likely things to happen is suicide, we need to put a plan in place ahead of time so that we can be responsive to not only our students, but our staff and the community as a whole. So on the next slide, I also want to suggest that postvention is part of prevention. A lot of times people ask why are we so focused on postvention, but the Suicide Prevention Resource Center, which this graphic comes from, and the link is at all the resources I mentioned, the link is at the bottom. The Suicide Prevention Resource Center identifies postvention as one of the key elements of comprehensive. How do we do this? Looking at it not as a start to finish, but as cyclical. So we need to be prepared ahead of time. We need to be prepared to respond. And one of the things we also know is that while most people who are exposed to suicide will not attempt or die by suicide, it is a very significant risk factor. So we have to take time to address that and understand that for us to be effective in prevention, we have to address postvention. So next slide, I just want to identify a few of the resources. I'm not in any way connected or gain money from any of these resources. They're just really good ones, and I want to share them with you. At the top of the list, you see After Suicide from AFSP. It really takes you kind of, if you have nothing in place, and if you pull up that toolkit, you'll start in a good spot. It's got sample letters to students or to the community, statements to students, how to address your staff. The Hurt Alliance, a toolkit for mental health promotion and suicide prevention, really is wonderful because it's a clearinghouse of kind of the best of, and they have a section on postvention. If you're going to read one book on this topic, Suicide in Schools is phenomenal. One of my favorite parts about it is it talks not just about what do we do now, but what do we do in the future. And then SAMHSA was kind of the first in this space about creating this comprehensive approach. So next slide, please. All right, so also this is not just me saying it, it's not the national strategy saying it, it's not just a state strategy, but the CDE's model policy identifies that postvention needs to be part of your comprehensive policies. And that's why I think our state did better than a lot of other states. A lot of other states only required educators or coaches to get an hour or two of training. We really wanted, the mandates were there to create a sea change, to say that we need comprehensive. We don't just need to focus on a 1 hour training. We need, how are we going to screen and assess, and also how are we going to respond after suicide? So I just want to include that to say this is not just me advocating for this. As you heard from Carrie's kind introduction, I'm a loss survivor. I lost one of my best friends as a freshman, and it still sits with me. It took shavings off of my soul, and I think anybody who's been in part of a school or school district who's responded to a suicide, you know exactly what I'm talking about. So next slide, please. All right, so why do we need to talk about this? One of the most important reasons is that a lot of times schools are unsure. You have pressure from your school board, from your PTA, from your community, whether to talk about it more or sometimes to like not say anything. You also run into the complication of what if the family, guardians, caregivers of that youth don't want you to talk about it as a suicide? How do you honor that request, but also understand your responsibility to the youth who might be at greater risk because of this? And the truth is that a lot of practices schools do for other situations may actually put youth more at risk when it comes to suicide if we shut it down, if we try to sweep it under the rug and hide it in a closet. But what we do know, what the evidence, the research shows us, is that if we're open, we're direct, that we can actually reduce the trauma and risk that the youth who are exposed to that suicide experience, therefore preventing future suicides. Next slide. And when we think about suicide loss, we oftentimes think about the best friends, the teammates. I do want to encourage you, and when I do my full day trainings, one of the things I talk about is that we really have to think outside. Like, who else might be triggered or activated because of this? There's youth who maybe have lost somebody, a loved one recently. There's youth who have certainly dealt with suicide ideation, suicide attempts. So they don't need to have a direct connection to the individual, but just being in a school or even in a community. So we need to really widen our net about who we should be checking in on. And so just understanding that suicide and the impact of it varies from person to person. So next slide, please. Now, when it comes to postvention, it also involves prevention, intervention, but I would say one of the most important parts of postvention is how we talk about it, how we message, how we communicate to our students, our staff, the community. And again, sometimes our hands are tied by the family, by the, what's going on. And sometimes that can lead to resentment. So with the youth who are like, why aren't we talking about this? I remember that, I experienced that, like, why was the only person that talked to me about this was my geometry teacher? We need to have communication strategies in place. So again, just looking up and sharing drafts of, like I mentioned, the resources, having a draft template for, your statement to students, having an option for your administrative staff, a script for them to answer the phone if concerned parents call in. But how we talk about suicide, especially in the aftermath of a suicide, can really have an impact. So I encourage you to check out the website. This is from the National Action Alliance that creates the national strategy, which was just updated last year. I'd really encourage you to look into how you communicate and having some things prepared. All right, next slide. So where do you start? You may already be, knee deep in this. This may be the first time you realize that, like, hey, our district, our school has nothing. So in honor of SDCOE, San Diego County Office of Ed, they've done tremendous work. I partner with them. We updated the SAMHSA suicide postvention checklist, which again, you have the link there. I hope it's the right one. If not, we'll send it out. But just starting to ask some questions. And this is kind of a devil's advocate mentality. What happens? What doesn't happen? What procedures are in place? What's not in place? And talk to your survivors of suicide loss groups and see what's missing and how can we do better. I know I'm short on time, so we'll move to the next slide. Just thinking big picture, again, this is by no means a comprehensive training, but just some things to think about. I think schools are pretty good at bringing in the professionals to do the crisis response, but how are we communicating the responses there? How are we engaging the full community? Again, how are we bringing in communications, messaging? And one of the big kind of milestones in postvention is how are we memorializing or not memorializing? What are our policies? And your board policy should absolutely include that. And then also realizing this isn't something that resolves in 1 or 2 weeks. This is something that's going to continue. So how are we going to be prepared to support our staff and our students ongoing? And finally, just real quick, I think one of the things that gets missed, if we go to the next slide, in the toolkits and the resources out there is like what actually happens, boots on the ground. What are you going to do with the empty seat? How are you going to support your teachers? So bringing in a counselor or a school psychologist, mental health professional to shadow the student, moving the seats from theater to, circle seating, bringing in substitute teachers to support the teachers who had the student who are also grieving and are also survivors. Just thinking about some of the practical things. And the last one that's really important, or the last two, one of the most horrific stories I've ever heard is parents getting an absentee call from about their student the day after they died. So having these kind of micro steps in place to remove that student from the absentee list to avoid that added trauma that this family's already experiencing. And I think that's about it. If you go to the next slide, there's my contact. I'll drop it in the chat. I hope I kept to my time close enough. But thank you all for being here. Thanks for your support and thanks for the work you do to support our kiddos every day. So I'll go ahead and sign off on that.
Thanks so much, Stan. And I appreciate you and your knowledge and how you always step up when we are needing you to provide the best practices and resources and supports to our school community. So thank you very much. I do want to echo what Stan said. As being a previous high school principal, I think it's really important. I'm so happy it's on the slide to have someone actually follow the student's schedule, because it eliminates the rumors. It's just that supportive role. Happen to be a counselor at our high school, and I think it's a great suggestion. So thank you very much for that, Stan. I appreciate you very much. Okay, now I have the pleasure of introducing Devin Saragoza Harris with Youth Creating Change and Hope and Justice. Devin holds a master's in public health and is a senior program manager with Youth Creating Change. She holds a master's degree in public health from UCLA, go Bruins, with a concentration in community health sciences and specialization in health education and health promotion. She has worked with youth of all ages throughout her career in the nonprofit sector and has been a passionate advocate for mental health. Devin is also a doctoral student at Johns Hopkins Bloomberg School of Public Health, where her coursework is focused on adolescent development, public mental health, and spatial data analysis. Devin, would you come join me?
Thank you so much, Carrie. Can you hear me okay?
I can.
Perfect. Yeah, thank you so much for having me and for having Youth Creating Change here on this webinar. We are here to talk just briefly about our organization. You heard from Stan Collins, who is one of our co-founders, but really also want to specifically highlight our Suicide Prevention Week toolkit. So next slide, please. So Youth Creating Change, we're a nonprofit organization. We were formerly known as Directing Change, if you've heard of that, but that is our signature program, as well as our Hope and Justice program. And so we are focused on keeping youth at the center of suicide prevention and mental health programming across California. And we administer that through curriculums that are free for all schools, youth-based organizations, clubs, and it's delivered through a film and art contest, both Directing Change, which is our film contest, and then Hope and Justice, which is a little more broad and does film and art in any medium. But we also do awareness and education pieces, one of which is this toolkit I'll be talking to you about. We have the trainings that Stan was mentioning. We also do support after youth suicide, death, and parent engagement pieces. And in general, yeah, we follow the learn, apply, share model, where we have youth engage with curriculums and lesson plans and educational videos so they get that content around suicide prevention, around warning signs, resources that are available to them, the importance of identifying a trusted adult. And then they apply those as they create these art pieces and these films that are about suicide prevention and mental health. And then we do try to share the pieces as much as possible. We encourage the communities that these youth are a part of to share them, to uplift them, to give youth a platform to talk about it, as well as our organization shares throughout the year. And one of the ways that we do share them, toolkit that I'll be telling you about. And then next, please. And this is a short video that kind of talks about what our organization does.
Youth Creating Change was founded on the idea that stories, storytelling, creative expression are some of the most powerful tools we have to engage youth, to give youth a voice, to put them at the center of mental health and suicide prevention conversations that we need to have in our communities, in our schools.
Our programs encourage young people to be courageous and genuine, using their creative talents and artistry not only for self-expression, but to make a difference as well.
We deliver curriculums through art and film contests. Youth apply what they learn to film and art projects, have discussions with their peers, and showcase their projects in schools and communities.
Youth express what they are going through and their hope for the future through the lens of their culture.
They left behind their world to find a better one for my sister and I. And every day I witness the struggles they have faced to allow us to call America home.
Art, film, poetry, and music have the power to open our minds and hearts, to foster belonging, and change the culture about mental health and help seeking. When young people are at the center of their well-being, change can happen.
Great. So yeah, we have a Suicide Prevention Month toolkit that is available. We have, the link will be coming to you from these slides, but I'll also post it in the chat later. But essentially, if you want to be engaging the young people in your life, or really just the larger community, to be talking more about suicide prevention for Suicide Prevention Month here in September, or specifically for Suicide Prevention Week next week, we highly encourage downloading the toolkit and using it. You can use all the pieces in it. You can kind of pick and choose, but we pulled out a few different pieces that we thought were really, we really hope people can use. One of them is this post, and it comes, you can post it yourself. We also have a social media caption that can be added with it. That was created by one of our youth council members. It's an animation that she created about 5 ways to get through the moment, talking through, if you are currently in a moment of crisis, if you're really feeling like, I don't know how to get from right now to 10 minutes from now, just a beautiful animation that one of our youth created for this toolkit specifically. I believe it should play, if we could play it. There's no sound, but this one is just like a really beautiful animation that can be posted and shared.
Devin, would you mind dropping the link so people can listen to this sound? That'd be helpful on their home computers.
So this one actually does not have sound. This one is
Oh,
just
okay.
an animation.
Got it.
So we're all good. But the next one will have sound. So if that one doesn't work, we'll definitely send the pieces. Yeah. And I should also mention our suicide prevention toolkit comes in English and Spanish. So I have currently linked the ones for this presentation in English, but the whole toolkit is also available in Spanish, including different social media posts and graphics as well that are translated. And then, as I mentioned, our Directing Change program that has youth create short films about suicide prevention and mental health. We highlighted several films that were created this year by youth in California for this toolkit and pulled them out specifically with different tenets of suicide prevention. So again, if you wanted to share specific pieces or just watch them yourselves, you can kind of go through the toolkit and see the different pieces, but just some really beautiful pieces of art that the young people around us have created. So for example, this one is called The Conversation, but really focusing on finding the words and asking directly, are you thinking about suicide when you're worried about a peer or someone in your life? We see if this one plays. This one should have sound.
Okay. Let me go over it again so I don't chicken out. I looked up the warning signs for
suicide. I mean,
he never hangs out with us anymore. He doesn't talk to us. It's just like he just doesn't
care anymore about any of the things that I used to care about.
I mean, I know he's been having trouble with drugs. Maybe that's it. And problems with
my ex, my parents' divorce, and homework and school, and
maybe that has nothing to do with any of this. God, I
hate myself. Why can't I just
ask him if he's okay? I mean, it's weird. He's been so happy all damn week. It's like
I've made a plan.
Am I imagining it? God, what if I make everything worse?
I wish someone would just ask if I'm okay. I don't know what to do.
What am I gonna do? I need help.
Oh, hi.
Hi. Are you thinking about suicide?
Start the conversation. Learn the warning signs.
And then, yeah, we'll just watch one more because I know we're short on time. But this other one, this is another embedded video and a graphic that you can share that's really talking about reaching out, talking about 988 or another crisis line. And this film came from students in Contra Costa County called On the Line.
Eli! Hey, it's okay. Just breathe with me, okay? Just stay in the moment and breathe with me, okay? Do you want to talk about it?
I don't think I can be by myself right now.
Eli, are you thinking about suicide?
Yeah.
Okay. Listen, I'm on my way. Try to ground yourself, notice what's around you, breathe, and I'll be right there. Hey, it's okay, I'm here now. Thank you.
Call or text.
All right, and can we skip this slide just for the purpose of time? But yeah, just in general, as you can see, we have just some really incredible graphics. We have some stationary art as well, but then also these videos that can be embedded really, directly from the youth, whether they're creating a fictionalized piece or actually a piece from lived experience, talking about how to support the people around them, conversations they want to be having more with their peers, as well as some conversations and topics they wish they could speak more openly with their parents about. And that actually kind of leads well into our hope and justice prompt. So this is our contest that accepts art and films in any medium. So short stories, digital drawings, original music, choreographed dances, TikToks, really any art medium that a young person might be interested in. And we have a prompt open. This one is actually going to be open for a few months. So if you have any youth that are interested in creating a piece that was about what I wish my parents and other adults knew, this was one of them that our youth council really felt very strongly about, that it was really important to open that up as a prompt for the people around them. So talking more about, what do you wish your caregivers and the adults in your life knew about mental health, about suicide prevention, and about the support that you need. So for that, they can submit on our website by January 31st. So plenty of time, but could be a good activity as they start engaging, in different activities and events going on for Suicide Prevention Month. And then, that about covers it for me. I will put some links into the chat about the toolkit, which you can download and use, as well as my contact information. Thank you.
Thank you very much, Devin. I appreciate you sharing the videos. I just want to emphasize the videos were created by students. We don't train students to ask students if they are contemplating death by suicide. It's just in honoring the students, they created it themselves. So I really appreciate that information. Thank you very much for sharing it with us today. Okay, so next I have the honor of introducing Isla Tom Chirico. Los Angeles Unified School District is in the house, super happy. She is a licensed clinical social worker. She has served the Los Angeles Unified School District for 24 years and is in her 15th year as coordinator for school mental health crisis counseling and intervention services. She leads teams focused on crisis response, threat assessments, workplace violence prevention, suicide prevention, and trauma recovery. Elliot is dedicated to restoring safe, healthy learning environments after critical incidents and advocates for the wellness of children, promoting the right to safe, nurturing homes, schools, and communities. Would you please join me?
Thank you, Carrie.
Of course.
Good afternoon, everyone. It's great to be here with all of you. I thought it would be appropriate to start off by sharing just a little bit about just a message around what school mental health is for LA Unified. And I wanted to share some words with you from our school mental health director, Lakeisha Johnson. So school mental health is committed to disrupting the intergenerational transmission of toxic stress that impairs health and debilitates dreams. We promote healing across generations and throughout our system of education. And so with that message about what school mental health does for the district, it is really an honor to be here with all of you to share some of the highlights of what we are doing in the second largest district in the nation around suicide prevention, intervention, postvention, and then as a result to promote healing. Next. So we wanted to make sure that we covered the objectives that CDE put out and that Carrie so eloquently shared with us. So for objective 1, I'm going to be sharing a little bit about what we do in terms of district policy. And our policy is actually called Suicide Prevention, Intervention, and Postvention. I'm going to share with you some information about what we do for our Every School Safe training modules. And then I'll talk also about our mandatory training for all staff. What you'll notice, though, is that we use a triple track agenda. So typically our policies and our trainings really want to address the 3 main stakeholders in our community. So our students, our staff, as well as our parents, caregivers, and families. Next. So here's a really quick snippet of the district policy that we have. So I really appreciated seeing San Diego Office of Ed and your resource guide with all of the tools and resources, and kind of like just the way San Diego school district has asked for, like, what do I need to do? The same thing happens in our district. And so what we did is we've developed district policy that really outlines the stages of the suicide risk assessment process. Because in every school, I believe in California, but in LAUSD, we have what's called an integrated safe school plan. And this is all part of our incident command system, which is a national and state mandate. But within that emergency team that is identified, or the incident command system team, we also identify what are called multidisciplinary crisis teams. And embedded in those crisis teams, what we have are individuals that have been identified to provide social emotional support in the aftermath of a crisis, like a death by suicide of a student. It could be a staff member or even a parent or a caregiver or family member. And so within that crisis team, schools also have to identify what's called a suicide threat prevention liaison. And those individuals receive additional training so they know how to engage in these 4 steps. So the QR code actually will take you directly to our policy. As you know, we've been talking a lot here in the last hour about California Ed Code 215, or also AB 1767. I think they are interchangeable, but I always say California Ed Code 215, where we now have to post our policies so that they are public documents. So you're able to see those and see some of the handouts that we have curated in LA Unified. That being said, so we have our 4-step process. Number 1 being immediate risk reducing interventions. For all of you guys here from school districts and agencies, you probably can imagine what that means. It's anything from making sure that if a student brings something that they might be thinking about using, that an admin search is done. If someone has consumed an unknown substance or a known substance, or has made an attempt while they're on campus, calling 911, that sort of thing. And then we walk them through assessing for suicide risk and provide them with that guide. Communicating with parent guardian, I'm going to share a little bit more about that, is our 3rd step and super important. Sometimes we forget to do that. And so we really thought it would be important to embed that in our policy. Not that we forget, but I think it's not a step that we go to right away sometimes. And lastly, it's implementing the action plan that has everything to do with making sure that we have determined what next steps are going to keep our students safe, and making sure there's a safety plan. And if the student has been hospitalized for a psychiatric evaluation, what does that reentry plan look like? Next slide. So for communicating with parent caregiver, we even developed a conversation guide for our staff, because it is a hard conversation to have. It is hard to make that phone call to a parent and let them know that their child has been either engaging in self-injurious behavior or self-harming, or thinking about dying by suicide. And so we give them prompts about things to consider: a confidential space, giving parents time to get there, giving them an opportunity to show up the next day if they can't come that first day, but always thinking about safety first, right? So communicating what we can as soon as practically possible with a parent. Next. And then last, the implementing the action plan. Our action plan is going to look different depending on the level of risk that is identified for that child. But there are some universal steps that our district makes sure to take. We want to make sure our school administrator is aware. We want to make sure to connect a student and family with those mental health resources. Universally, we communicate with parents, even if it's no known risk. Like, even if a student has been singing lyrics to a song that talks about suicide, and we can, nowadays we can just Google it and it's really easy to determine if that or those are lyrics to a song. And of course, we will ask more questions about why they like that song and that sort of thing. But we always want to communicate with parent caregiver. And as you can see through here, it goes all the way to monitoring and managing, and then documenting actions taken. Next. These are some of the handouts we've curated. So you'll also find these where that QR code was, and I will put up a link after I'm done here. So we've curated material around suicide prevention awareness for parents and caregivers in Spanish and English, also around self-injury. We have a list of mental health supports and resources that we've already reviewed here in this training as well. Next slide. And then we also curated trusted adult and student upstander handouts. And we've worked, I saw Sandy Hook mentioned in an earlier slide. And so we have been working with Sandy Hook Promise as well to curate some of this material. And so you'll see that we acknowledge them on these flyers as well. And so we share this information because as part of the safety plan, students do identify trusted adults. And we want to make sure that those adults that are identified know what that means and know what they might need to do if a student that has identified them comes to them in a moment of despair or when they're in crisis. Next. So the other thing that we're doing in our district, and this is the third year that we've been engaging in what is called Every School Safe training, is the district has identified like a crucial key training that they want delivered on a triple track agenda. So they want delivery around grooming and adult sexual misconduct. They want delivery around threat assessment and management, around bully prevention, around cyberbullying and how to be safe online. And so for September, for the last 3 years, we have curated materials and videos around suicide prevention and awareness that does get so that it's viewed by all students in every single school. And so we develop it also for educators as well as for parents and caregivers. All of this is done virtually and via video, but these are kind of like the cover slides for the trainings for this year. And this year we collaborated with Erica's Lighthouse for to present the material around depression and around understanding feelings. If you could go to the next slide, I can show you what the student ones look like. So this year we have 3 student presentations. For K through 5, we actually don't necessarily utilize the word suicide, but we talk about big feelings, small feelings. We talk about what it means to feel sad and what are some of the things we can do to manage those big emotions, including identifying trusted adults. And then when we get to grades 6 through 12, which are our secondary students, then we do talk more about what mental health is. We explore the signs and symptoms of depression. We talk about the warning signs of suicide. And then we also talk about self-care and coping. And then also how to be that student upstander, right? How to learn what to do and how to help a friend that might be in need. Next. And this slide gives you information around our mandatory training. So in 2016, when California Ed Code 215 came out, for those of you that may or may not recall, the Ed Code actually outlined that we specifically provide training and information around the warning signs, risk factors, and protective factors for suicide, specifically for 6 through 12 teachers or educators. And I also just want to highlight and acknowledge our late superintendent, Dr. Michelle King. She was a superintendent at the time. And I remember walking into her office and saying, look, we have bus drivers, custodians, we have cafeteria workers and clerical staff that interact with our students on a daily basis. And we would be remiss if we did not include them in this mandatory online asynchronous training. And she agreed wholeheartedly. And so since day one, we have been issuing this mandatory training for all staff of the district. And we're talking about 80,000 employees in the district. And our training is broken down in the modules that you see here on the screen, really to cover what the Ed Code, kind of outlined for us to cover, but also all the signs and the things that an individual that works with students can look out for, not necessarily to engage in that assessment piece that I showed you earlier. That would be for the crisis teams, but to know who to refer a student to. And so that's what we walk them through. We also share with them the 5 components of psychological first aid. So you can go to our next slide. And so psychological first aid, listen, protect, connect, model, and teach. So we modified it with the permission and partnership with the UCLA Center for Public Health and Disasters. And so this is what our PFA handout looks like. And it really offers, and it can be used not just in the aftermath of a death by suicide, but also in the aftermath of any type of crises, and including a student that is being assessed, that is in crisis and is thinking about or having or exhibiting suicidal ideation or behaviors. And so this handout with the QR code, you can access in 10 different languages. The main 10 languages spoken in our district, even though we have dozens more. Next. So for objective 2, strengthening communications and intervention skills, I just wanted to share a little bit about what we do in our district around this regarding our resource line, consultation line, and our annual trainings. Next. Okay, so these are our 2 resource lines. The Student and Family Wellness Resource Line actually started during the pandemic, but I want to say it actually started many years before, just in our office where someone would call our main school mental health line and ask for help. But, you know, during the pandemic, everything really just went virtual. And now we have dedicated staff, dedicated psychiatric social workers that are on the phone, as well as wellness navigators that provide basic resources and health insurance connection. But then we also have clinicians or psychiatric social workers that are available to support students, staff, and families that may need mental health support. The majority of our calls come from staff that are supporting students. So for example, it could be someone who's pretty new to the district and they say, I have a student that just said they were suicidal. I don't know what to do. And our staff are there to literally hold their hand virtually by phone and support them through that risk assessment process from A to Z. The other really exciting service that we offer is for our after school programs and our expanded learning programs. So this is our Beyond the Bell mental health consultation line. And those 4 staff that you see there are available in the evenings to support the after school program staff who, for those of you that have after school programs, I know many of you do, but not every school does. But they're young and they're inexperienced and they're not quite sure what to do when an individual expresses suicidal ideation. So we also have psychiatric social workers that support with that. Next. And so one of the things that we really focus on every single year in our district are 2 big chunks. One is our annual district crisis team training that we have annually. And this year we celebrated 40 years of stewardship. And so it was really exciting. These are images from our most recent annual district crisis team training with our superintendent, but also every region. We have 4 regions in our district, East, West, North, and South. Every region holds crisis team trainings for those school site crisis teams that I talked about earlier. And so those trainings really take their time to go over the steps in the suicide risk assessment process. And one of the things we're starting this year is also engaging in some role playing, because we know, again, as you know, I know I'm preaching to the choir, engaging in that risk assessment, if you've never done it before, can be really scary. But we do depend on our support staff in our schools to make sure they know what to do. And if they don't, that they know who to call. And so I'm going to just share a quick video with you that is about our 40 years of stewardship. Next.
I am one of many, alongside remarkable leaders who salute the work you do, who recognize the indispensable transformative healing power that you bring to heartbreaking, devastating conditions faced by our children.
So we are here for the annual crisis team training hosted by Student Mental Health and Wellness Services, where we bring together crisis team members from across the district for a day of learning, a day of coming together to build community, and most importantly, to get the year started on the right path.
It's important to have crisis intervention services in our schools and for our communities, because when crises do happen, we have to intervene immediately. We have to make sure that our children are socially and emotionally coping with the crisis, because the more you do not address these issues, the worse it becomes later. So it's important to be proactive rather than reacting to when a mental health crisis reaches a limit.
While we depend on school site crisis teams, schools often lean on us as a resource in the aftermath of critical events. And so we have here representation from all the different regions as well as central offices, so that when a crisis exceeds the capacity of what a school can provide, then we reach out to our regions and our central teams to come in and offer that support to schools.
Hope is everything. You give me hope. You give each other hope. And to the world, you may just be one person, but to one person, you could be the world. Thank you for everything that you do.
So that last speaker was Dr. Marlene Wong, and for those of you that may or may not know her, she started crisis teams in our district 40 years ago, and so she was our keynote speaker this year, and we were really honored to have her. Okay, moving on. For objective 3, fostering a culture of connection and support. We have monthly campaigns, and of course, in observance of Suicide Prevention and Awareness Month, we're celebrating that as well in terms of campaigns and making sure that we are engaging in outreach and social media, and then a multi-tiered approach to supporting students. Next. So this year, our district launched a monthly I Matter campaign that includes social media and other forms of outreach and communication to promote mental health and wellness. So every month, we're going to have a different topic. So as I mentioned, September, our campaign is for Suicide Prevention Month. And another example would be October is going to be My Identity Matters Because I Matter, in observance of National Coming Out Day. That's just a little bit about our campaigns. Next. And then lastly, I wanted to share some of the supports that we provide in a multi-tiered level. And so I know this is familiar to you. On a universal tier, we have what I mentioned, the monthly campaigns. We have had for the last few years a youth mental health symposium. And this past May, we welcomed 800 students to our symposium to talk about wellness and mental health. For our targeted services, we offer classroom and group interventions. And then I'm really excited to share some of the intensive or tier 3 supports that we offer our students. Next. So 2 programs that started in the aftermath of the shooting in Parkland, Florida are the mental health evaluation team and case management team. So I'm not sure if you're aware, but LA Unified has a school police department. And so we work collaboratively and we have a partnership with them where now we have paired a clinician with an officer to provide compassionate field intervention, triage, and appropriate linkages. So when a student is identified as high risk, when they're in their school, schools have the option to call law enforcement, their local law enforcement. They have the option to call Department of Mental Health for LA County, but they also have the option of calling one of our teams. And the picture you see here is actually one of our teams. As you can see, our officers drive an unmarked car and they are paired with a clinician, and they're in a soft uniform. So they're not wearing the regular police uniform. They wear khakis and a polo. That softer look really helps with the engagement and establishing rapport. And next. The MET response looks like this. It looks like engaging the student, engaging in that assessment process, collaborating not just with the family of that child, but also collaborating with the school staff that made that referral so they know what next steps they need to take, and then offering suggestions for safety planning. Next. Our second team that was also developed in conjunction with MET is CMT, or Case Management Team. And Case Management Team was developed with 6 clinicians to really reduce the risk of suicide and homicide among our most vulnerable students. And really, more than case management, the way we typically know it, which is supporting someone with finding some basic resources such as food and housing, which, by the way, is extremely important. So I'm not downplaying that. And our case managers will often have to do that too. But part of what they do is really the students that they see are students that have expressed suicidal and homicidal ideation. So if you look at the next slide, you'll see some of the criteria. So CMT was designed to support students with high-risk behaviors around severe suicidal ideation, recurring hospitalizations for psychiatric evaluations, and then also any threat violence infractions that have been identified by the school. So that's some of the criteria that we use for taking on and working with students that have been identified as high risk. Next. The other thing that we do, and I really appreciated Stan Collins and his presentation around postvention, is we started postvention support for our psychiatric social workers. And really it's a short-term supportive response in the aftermath of a suicide, because often our PSWs are dealing with not just one death by suicide of a student, but they may have had multiple. And so we really want to give them an opportunity to discuss their experiences in a safe way and offer them the opportunity to grieve and grow and learn from it. Because what we have learned is that it does change their practice. Sometimes it can change it in a positive way, but sometimes not so much, because people become perhaps highly anxious. And the emotions are so complex around this, it really gives them an opportunity to process. Next. And I just wanted to end on a high note. The other thing that we offer our district on a tier 3 level, but also on a universal level, so it's both, is our facility dog Trixie. And Nicole McMahon is the handler. I work very closely with her. She takes care of and supports Trixie. But Trixie participates in kindness events, in attendance campaigns, but also she participates in crisis response. So these are kind of like her numbers for last year, and she interacted with over 17,800 students and staff in the 24-25 year. So I would say she's probably one of our hardest working employees in the district. And that's about it for me. Thank you so much.
I am in absolute awe and appreciation of you sharing your knowledge with us and what you're doing in the practical day-to-day with LA Unified. That sounds amazing, and we're all learning. I am learning from you. There are a few questions for you for links that people are requesting, and I have to tell you, Trixie is adorable, and think of the impact that she's having on students' lives who may not have access to a pet like that. So thank you, but your programs and everything is just, it's huge accolades, and I really appreciate meeting you. Okay, we're going to go on to our next presenter. This is so much good things. I'm in awe of everything going on. So next, I have the pleasure of introducing Nora Hanna with San Joaquin County Office of Education. Nora holds a Pupil Personnel Services credential and is a certified youth mental health specialist. She is the director overseeing mental health student services and substance use disorder prevention in coordination with San Joaquin Behavioral Health. Nora manages the California Healthy Kids Resource Center, a statewide lending library for schools in California for prevention curricula, such as tobacco, marijuana, smoking devices, drugs, violence, and positive school climate. Nora, will you come join me?
Good afternoon, everyone. It's such a pleasure to be here. Thank you so much for having me. I am really excited to share with you a little bit about what we do in San Joaquin County. And we are super, super proud of one of our programs that we have been blessed with, to be honest, to be able to administer here, called the Youth Mental Health Development Academy. This academy is a peer leadership program that helps students in high schools really take a higher role in being that peer-to-peer mentor. We've heard so much about how that makes an amazing impact on our students and how they talk to each other before they talk to us. This program takes it up another level. Next slide. So the program focuses on these core competencies. We initially thought of things that really students are facing in their lives, and they could cause a mental health breakdown, or they could be something that could trigger some act of having a suicidal thought. So the core competencies are a overall mental health picture, understanding what mental health is, what grade mental health is, what kinds of things happen to us. We obviously go through suicide prevention. We talk about what that looks like. We employ the practices that students would need to be able to step in when they need to help one another. We talk about human trafficking because there's an intersection really about safety and what happens to students in crisis and what kinds of things they face when they are in a situation where they're not safe and how they get in that situation. There's been documentation of students where because of loneliness and because of not feeling like they fit in, they feel like they need to connect with someone outside of their community or outside of their area. And sometimes this lends them down a hole that's not really a great place to be. We also talk about substance use and co-occurring disorders and what that does in the frame of mental health. Social media safety comes into play and looking at cyberbullying, and then of course school violence. Next slide. So how we got this program up and running was we were funded through BHSSA Round 3 through the Commission for Behavioral Health, and it takes students a whole new path of learning. So our students that are in high school, sophomores through seniors, we've had one freshman that went through, are able to apply and be accepted to this program. Our proposal was modeled after Students in Prevention and how that program really took shape and what that did for our students in our county. They apply, they are part of a cohort that lasts all year. We've had 70 students go through the cohort so far in the last two cohorts. We're on our third cohort with another 40 students right now. Next slide. So this is kind of what it looks like. Students apply for the program in March. They are then interviewed by us. And really what that looks like is they have to have an application and 2 letters of recommendation from their school. They don't have to be the most successful academically, but we want to see what their drive is. What is the reason that they want to be in this program? What kinds of things are they hoping to achieve? And I'll tell you, 9 times out of 10, every single student has told us that they have either had someone in their family that's been impacted by suicide, or they face mental health challenges themselves, their friends, their peers, and they just don't know what to do. And so they want to take the initiative to be able to do something and really be empowered. So their work begins in the summer, which is also a huge commitment. In the first week of June, they come in and they have a whole week of training here at the county office. They are here with us from 9 a.m. till 2 p.m. every day. Then they have another week that they go to Sky Mountain with us, and I'll talk a little bit about that. And then they have a third week that's we've actually added on, that's a virtual week that they have trainings for. So in the summer alone, these students complete 80 hours of training. During the school year in August, they come back to the county office once a week. They are here for the whole entire day, so they miss a day of school. They're excused from school. They have a new topic that they learn about every month that they come into our county office, and that involves many of our partners. Next slide. So this is a little glimpse of week 1. They are first trained in teen mental health first aid, so they are certified teen mental health first aiders. This was a huge undertaking for us because, as you know, teen mental health first aid has specific requirements, and we were able to meet those requirements because we're training a whole entire cohort of students. We are not eliminating any students for any reason, and because these students are part of a specific group, they all are able to go through this training. This was a really proud moment for us because these are the first students in our county to ever be trained in teen mental health first aid. So that was a huge win for us. And they take it so seriously. They are so proud of that certificate. We have a great celebration at the end of the week when they are certified, and they just are so excited to have that certification. They also get some trainings from local experts and some national experts. We bring change to mind. We've brought in mind-body awareness. We've brought in social workers and other clinicians from our county that work in specific areas, and other experts to be able to come in and help them. One of the great things this year was we actually were able to go to public health and public health train them on different things about mental health. They also trained them about substance use and how that plays into it. They looked at some of the uh, some of the numbers and statistics that are happening in our county. We're able to equate that back to what can they take and use that to be able to create change in their communities. They also participate in some team bonding activities because they come from different schools, so they really don't know each other. Next slide. This is week 2, and this is my favorite week. This is where we go up to Sky Mountain, which is an immigrant gap. It's our county office has an outdoor education site, and we take over the whole entire area. Students stay there with us for 4 days, 3 nights. They are trained by Every Monday Matters. So Every Monday Matters accompanies us there, and they talk about I matter, you matter, we matter, and how that together is a collective whole, and what happens when we're all taking care of each other, and then what happens when there's a break in that care. They create vision boards. They participate in art therapy. We have a lot of hiking, a lot of journaling. One of the best pieces is campfire. Campfire is really strategic. At night, they talk about creating their why and really understanding their why statement and what kinds of things that can do for them. This past year, it was so powerful that many of the students had some really profound things that they talked about that they had never shared with anybody else, which was really therapeutic for everyone. Next slide. The same students also oversee a podcast, and we have a website for student wellness that is for our county, and all the podcasts live on that website, and it's accessible for all students in our county. These are some of the people that they have interviewed in the past. They've done also athletes. This last year, they wanted to interview our Stockton Ports because they wanted to talk about mental health and sports and how that plays in and what kinds of things happen and to their mental health. They've interviewed each other. And as you can see, they've interviewed Tony Hoffman, Amy Neville, Matt Immersion. There's so many other ones that are done, but they're still waiting to get them finalized and put up on the website. Next slide. So another task of the students is to create student presentations. And what that means is they're tasked not only to learn about mental health and be out there kind of helping each other and advocating for each other, but they're really tasked with going out and presenting to their school communities, whether it's in their high school or in their middle school. They have to do 3 presentations a year. They work in groups, and they create these amazing presentations on what they've learned. These are 2 samples of some of the things that the students created. We had no say in this other than kind of helping them along the lines of trying to change some wording or whatnot. But they really go, to all depths to be able to create these presentations, and they present them. And one of the biggest moments for them was they actually got to present at a state conference this last year. So they were at the California Mental Health Advocates for Children and Youth in Asilomar, and 9 of the students presented about their things that they learned, what they got out of the program, what kinds of things they are able to carry with them and be able to move forward. Next slide. Students also participate in community events. They are going to be this Saturday at the Child Abuse Prevention Council's annual Walk for Life. They will be having a booth there, talking about their program, but also talking to other youth about mental health and suicide prevention. They are presenting in 2 weeks at our annual peer-to-peer county-wide summit, where they talk to youth about their learnings, what kinds of things youth can do to help each other, really giving them some tips. Like I said, they presented at a state conference. We're hoping they present again this year. And then most recently, last May, they were at the Stockton Ports game for Mental Health Awareness Day at the ports. And so they were kind of the host of that day and were able to have their tables out there. As you can see, they have their Never a Bother boxes and some other things that they're giving away to students and talking about mental health. They were talking about all kinds of different things, human trafficking, drug prevention. They were just going up to students and just sharing their knowledge, which was amazing for us to just step back and see. Next slide. Here's a couple more of those presentations that I was talking about. They really hone in on different ways that youth are challenged and really come in with bringing some of those things from their own lived experience into the presentations and talk about what kinds of things they can do to help each other. Then also about drug use and mental health. Next slide. So one of the things that I think is important to recognize is this isn't always going to be funding that will be available to all of us to be able to carry forward, and what kinds of things can we do to be able to sustain it. And here we've been looking at how many things that we can do without funding. So we've noticed that our biggest costs obviously are staff, and then our trip to Sky Mountain because we take over the whole entire campground. So we're working with our folks from Outdoor Ed to be able to see, okay, what alternatives are there to Sky Mountain, or what kinds of ways can we do a share of cost and be able to either have students go up for maybe less time or be able to share the space with another group to be able to still maximize that outdoor learning, because what we've seen is that is the most therapeutic place for our students. Staffing, of course, there has to be someone to oversee the program, be there with the students. So those are our big costs. The rest of the program really is very easy to replicate. One thing that we really rely on here to make sure that it's very low cost is we partner with anyone in our community that we know can come in and be there for our students. We partner with behavioral health, with public health, community organizations serving our students, such as Child Abuse Prevention Council. We have other ones that are local to us that are specific, but they really love to come in and provide services. We partner with Saluna. We partner with many different places that I know that can come in and they have specific knowledge and skills that they are willing to share. Family Justice Center really loves partnering with our county office, the Pride Center, school nurses, counselors. There's an endless list, but it's different for each area. So if this is something that you would like to be able to replicate, I would say look for your partners. Who are they in your area? What can they bring in and how can they serve your students? Next slide. Some of the programs that we offer that really are impactful for students, I think these are things that really need to be there at all stages. Mindfulness, having the mattering mindset, drug prevention activities, human trafficking awareness, and wellness strategies. These give these students this well-rounded foundation to be able to carry some of the work forward and know that they have the tools that they have to succeed. They don't stumble. There's a lot of things that we do. We put them into a Google Drive. They're all ready for the students to pull out and use whenever they want. One of the biggest challenges, or not really a challenge, but an activity that students wanted to do was they were charged with Never a Bother. So we were the recipient of the Youth Suicide Rapid Response pilot program. And so we had tons of material on Never a Bother that were given to us. And these students took all of those materials, we created kits, and they took them back to their campuses, and they were the ones that plugged them into their schools and are able to really showcase what Never a Bother is. They hand them out to their peers. They have them posted all over their schools. They do activities with them. And this is one of the activities that they did where they had a big, massive board that they put on there, bother me when, and people wrote in when to touch each other, what kinds of things you can do for each other. Next slide. So another piece of that YSPRN, or the Youth Prevention Rapid Response pilot program, was to bring together a way to be able to reach families quickly in postvention opportunities. You know, we heard a lot from Stan about postvention, and I can't really reiterate how important that is. And so Focus is a program that we launched that is app-based for first responders to be able to connect with schools and be able to get information to schools rapidly. The program is not new. It is something that was launched in other areas. Stanislaus County also had it, but this changed it a little bit. That one was more trauma informed. We were able to add 3 different sections of trauma, suicide related incident, and suicide completion into the mix of that. Next slide. So this is kind of where it looks like as a dashboard. When students, when a first responder goes into a scene and they find that students are at that scene, whether it was the student that called or they just may be a bystander in a trauma-related incident call, they are able to, with permission from the parents or whoever is the adult there, they're able to enter information for the school to be able to track and be able to go back and talk to the parents or talk to the family and be able to put some postvention or intervention in right away, so there's not a delay in the time that we hear about it on the school side of it. This is kind of what our home base looks like. Next slide. This is the first responder side. They just really put some very simple information in. They put their information as far as their name and their email. They also put the student's name. Then they put in their school site, grade level, and then they indicate if it was a trauma-related incident, a suicide completion, or a suicide attempt. We're not saying who, we're just saying this is where I walked into a scene and this is what happened. This student is one of yours. Handle them with care, you know, make sure you are able to tap into what their needs are. So this program launched in January. Next slide. And this is kind of where our progress is. We've had 2 districts that are fully implemented. We have other districts that are getting trained right now to be able to start implementing. On the first responder side, some of the first responders are also getting trained at the same time. We've got 21 cases that have been entered, and 10 were attempted suicide and 11 were trauma-related responses. It's really fascinating because we were able to jump in so fast on the attempted suicide cases. The minute they enter them, I get a response on my end, and then the school district also does, depending on who they've gotten listed on their end. And so from the county level and the school level, we are able to jump in and both provide intervention right away, which cuts down some time for them to be able to have all the needed resources. We're still continuing, like I said, to train districts and first responders, and we're hoping that fully implemented by the end of this year. Next slide. That's it for me. This is my contact information. It's been a pleasure talking to you all, and I hope to be able to answer any questions if there are any.
Thank you so much, Nora. It's evident you're passionate and committed to the work you're doing, and it's great to hear of incredible programs like you have. So thank you very much. If you don't mind staying on so you can answer some questions, that would be wonderful in the Q&A. So next I have the absolute pleasure of introducing 2 individuals from the California Department of Public Health, the Office of Suicide Prevention. These 2 individuals have been committed to analyzing, receiving data, and literally thoroughly looking at all the different data points to support our school communities and all the communities in California. They are brilliant. And I'm very fortunate that I get to work with them very often. So first up, we have Melanie Schindel. She is a research scientist with the Office of Suicide Prevention at the California Department of Public Health. She currently serves as the evaluator for the Comprehensive Suicide Prevention CSP program. Melanie previously led the evaluation of the Youth Suicide Prevention, Media, and Outreach campaign, Never a Bother, which is a fabulous campaign, and the Youth Suicide Reporting and Crisis Response Pilot Program. With over 20 years of experience in human service evaluation, her work has focused on ensuring high-quality programming for youth and individuals with developmental disabilities across California. And with her, we have the honor of having Darcy Pickens join her. And she is a program coordinator with the Office of Suicide at the California Department of Public Health. Prior to joining CDPH in 2022, her career centered on public health administration and program development at the county level, working on topics as varied as environmental health, injury prevention, reproductive health, communicable disease, and emergency response within California's Central Valley. Darcy believes strongly in the critical intersection of public health prevention and social justice to drive positive change in communities. Melanie and Darcy, would you please join me?
Thank you so much, Carrie, for that wonderful introduction. Thank you, everyone, for being here. I'm going to kick us off. Again, my name is Darcy Pickens, and I'm a program coordinator with the Office of Suicide Prevention here in the California Department of Public Health. Next slide, please. And just a quick reminder, you heard some of this earlier, but we've been together for quite a while today. Please continue to make yourself a priority during this presentation and after. This is a sensitive subject. As others have mentioned, it can be activating sometimes at unexpected times. So if you need some extra support, remember you can reach out via call or text to 988 to reach the Suicide and Crisis Lifeline. Next slide, please. And a few other specialized support lines there for you, as well as a link to a more comprehensive list. And I'll be covering these first two sections here and then hand it over to my colleague, Melanie. We'll be covering everything at a very high level. So just to make sure that we try to stay within our allotted time, but this deck is intended as a resource for you. So know that everything we talk about, the intent is for you to be able to take that back and sit with it a little longer and pull it apart and put some of our suggestions into action. Next slide, please. And one more. Thank you. In case you're not familiar with the OSP, we were created by Assembly Bill 2112 in 2021, and you can learn more about all of the activities of the office, including our data on suicide and self-harm, our programs, our activities, and some of the resources we provide by visiting our webpage. And then, of course, we have Never a Bother centered on youth suicide prevention. Next slide, please. Very high level here. Suicide is a complex issue, right? We have no single determining cause, and a comprehensive approach is absolutely critical. So through the office, we strive to help create structures that support prevention at the population level. And this is one of the resources that we use to ground our work in an evidence-based approach, the CDC Suicide Prevention Resource for Action. Next slide, please. OSP also has 4 strategic priorities with activities and programs under each. We have suicide prevention communications, safe and protective environments, crisis response and postvention, so after a suicide loss, and continuing education and training. And each of these are data informed, driven by community input, and grounded in health equity. Next slide. We've been getting some questions about this, so we wanted to make sure we let you all know that 988 remains fully operational nationwide for call, text, and chat. The Press 3 specialized support option for LGBTQ+ youth was terminated in July, But California has partnered with the Trevor Project to provide additional training for our crisis counselors here in California to better meet the needs of this population on top of the training that they already have. And then in OSP, we also encourage you to share the Trevor Project Crisis Line as an additional source of support for LGBTQ+ youth. That's also available for free 24/7 via text and chat. Next slide. And one more. A few key dates to keep in mind this month. Some of these have been mentioned already. Another that we consider a critical time to promote suicide prevention is International Survivors of Suicide Loss Day. So a little bit later in the year, it's in November, but this is a critical day to talk about this subject. And then we've also listed a few other days throughout the year that represent great times to lift up this messaging in your school communities. Next slide. The next two slides outline some really simple actions that you can take to support suicide prevention throughout the month of September and beyond. So again, I'm not going to go into these in great detail, but each of them provides a suggested action and then a link to where there are resources for you to help implement that action. So we start with sharing support resources. There are links to toolkits for social media posts, virtual backgrounds, and ordering materials. And then next slide, please. Then we have the categories of raising awareness, expanding your knowledge. So things like brushing up on warning signs, taking some more in-depth training, and considering safe messaging practices, sharing support for lost survivors. There's some excellent things that Stan linked to. Some of the same right here. We encourage you to check those out. And then, of course, exploring data on suicide and self-harm. Next slide, please. Oh, I lost my place there. Sorry. Okay. And as you are taking action, hopefully in all of those ways that we provided on the list, one important thing to keep in mind is that when it comes to suicide prevention, the words we use help ensure people feel supported and encouraged to seek help and reach out for support, or they can push people further away from the support they need. Stan emphasized this earlier, as did a few others. So if you're talking about suicide or suicide prevention as part of your work, we encourage you to take a look at these next couple slides and ensure that you're using that recommended terminology on the left, things like died by suicide, rather than some of the terminology on the right, things like committed suicide. Okay, so whether you're talking about this in your professional life or your personal life, again, the way that you're talking about it matters, and these communications can go a long way to help support anyone who is struggling and really anyone who's been impacted by this issue. And I want to give credit where credit is due. Much of what you see here and on the next slide comes from Youth Creating Change. So we've linked to their absolutely excellent messaging tip sheet. Encourage you to check that out as well. Going one step further, thank you. When talking about suicide and suicide prevention, there are some guidelines that can help ensure our messaging is both safe and effective in addition to that terminology. Always providing a suicide prevention resource and reminding the audience of warning signs for suicide, reinforcing a positive prevention narrative that emphasizes hope with the words and images that you use. And I'll drop a link in the chat to some examples of what I mean there. And then avoiding sensational language that can make suicide seem common or oversimplifying the problem. So again, at a very high level, these are some of the things that we ask you to keep in mind. And a quote I like to keep in mind that reinforces the hopefulness we want to portray for those who are struggling comes from the Framework for Successful Messaging. The vast majority of people who face adversity from mental illness and other challenges, even those in high-risk groups, do not die by suicide, but instead find support, treatment, and other ways to cope. So I will leave you with that for now and hand it over to my colleague, Melanie. Take it away, Melanie.
Thank you, Darcy. If you could go to the next slide, please. Great. So I'm going to be walking you through how to access the sort of official data on suicide and self-harm for the state of California. But before I do that, we always like to remind folks that risk is a highly variable from person to person, and given the complexity of suicidal behavior and the impact of multiple risk and protective factors at individual, relationship, community, and societal levels, disparities in suicide, self-harm, and suicidal ideation can be driven by social determinants of health, such as exposure to adverse childhood experiences, poverty, discrimination, or even inequitable access to health care services. Research indicates that protective factors such as feeling connected to family, friends, and/or school and community, positive childhood experiences, a strong sense of cultural identity, effective coping skills, and reduced access to lethal means can support resilience and protect against suicide. So if you could go to the next slide. Again, as Darcy mentioned, going to be moving through these very quickly, and just want to highlight that this is extremely sensitive information. As we've talked about, I'm going to be talking about counts and things, and that is in no mean meant to minimize the fact that these numbers represent lives that were lost, but simply to communicate the numeric information that I'm describing here today. So when you access the epicenter, this is the first page that you're going to see, and that yellow arrow indicates 3 different ways that you can look at injury data for the state of California. And so this resource provides information on injury data, both unintentional injuries and intentional injuries. And so to look at, I'm going to be walking you through the steps and showing you screens that relate to death, suicide data, but the same steps apply to self-harm data that we often consider a morbidity factor related to suicide. And so you would look at that in the emergency department visit tab. So if you can move to the next slide, please. So when you click on that death tab, the first screen that you see is going to look like this, and it's going to show you the most recent year of data available, which in this is currently 2023. So there is a lag in the data, and there's a lot that goes into preparing the data, ensure that it's highly accurate. So we are usually a couple of years behind that. So the current year is 2023, and this is currently showing all of the injury-related deaths in the state of California for that year, which was 27,709 individuals. Next slide, please. But we want to focus in on suicide today. So we're going to go into look at the filters that are on the left side there. And we're going to be walking through a variety of these filters today. But the first that we're going to look at is in the filter by injury. And so you can pick multiple types of injury intents here. And you just click into that box and you're able to select one or more injuries if that is applicable to what you're hoping to look at. Today we're going to be drilling into suicide. And so again, when you select suicide, it's going to show you the most current year, 2023, but the count you'll see has dramatically changed. Now we're looking at the suicide deaths that occurred in 2023, and that was 4,191. So if you could move to the next slide, please. You know, it's hard to know what that number means an individual year of data without putting it into a larger context. So the next step that we often do is to look at the information over time and to understand what that 4,000 individual count of suicide deaths mean in relationship to what is happening on an annual basis. So what we do is we go into that filter by time, and we're able to extend the time period over a course of years. And so right now there is data available from 2016 to 2023. And so here you're able to see that in a table format, and you can see that the count of individuals that are that have died by suicide over the course of this period have stayed relatively very, very similar across that time. This table also, we add what we call the crude rate, which I won't get into the mathematical explanation of that here, but I'm happy to do that if you want to email me sometime. But by clicking on that, that checkbox that shows show rate at the top of the right-hand side, we see that crude rate. And what that does is it lets us know the number of individuals that died by suicide within 100,000 people for a given population or a given time frame. So in this instance, we're looking at the number of people who died by suicide within 100,000 California residents for that year. And so you can see the rate fluctuates between a high of 11.3 and a low of 10.5. So the rate change across those years is quite small. So going to the next slide, please. We're able to look at this data not just in a table format, but by clicking on the time series tab, you're able to look at it in a line graph. It's called time series, but that's just a fancy word for a line graph over time. And so what I want to highlight here is this graph looks potentially alarming to folks because the line is moving really up and down a lot. But if you look at the Y bar or that vertical axis, you can see that the range of numbers is going from the bottom number that I shared with you earlier, which was 10.5, to the top number that I shared with you, 11.6. So that's a very small range of numbers. And so as a result, that's really making the line look like it's moving around a lot. So I just really encourage you to be careful of that y-axis when you're reviewing data like this. The next slide, I share the same information, but in a bar graph. And I really like this a little bit better because it helps to see how over the course of these same years, it really, the rate has stayed quite stable. So moving on to the next slide, I'm able to share with you another way of looking at the data. And so in this chart, we are looking at, we've decreased the number of years that we're looking at, and we're just looking at 2022 and 2023, and you do that by adjusting those filters that you would see on the left-hand side there. And we've also changed the group by, which is where that yellow arrow is pointing. And we're looking at what we call age summary groups, and those are standardized groups that are commonly used in government at all levels. And so what I want to highlight for you all is the three lines at the bottom, the gray line, the blue line, and the green line. And those are the youngest populations, what we consider our youth in California. And so you can see for these 2 years, the rates have actually stayed very stable for those groups. So I want to move on to the next slide, please. And so again, this is looking at that same type of information, but just focusing in on the 2023 year. And this helps to put in a little bit better context. Again, I like the bar chart here because it helps to put into context those rates for 2023 and how they relate to other age ranges when it comes to the rate of suicide per 100,000 individuals. And just to say, when we're talking about a rate for a particular group, we're using the population of that specific group. So for example, the rate is calculated based on, for example, the number of 15 to 19-year-olds in the state of California, not against the whole population. So moving to the next slide, please. And so this is showing again that age summary data, but this is showing the counts rather than the rates. And so this helps you to understand how the relative number of deaths for each age group varies. And we can see from those younger ages are quite small. Can move to the next slide, please. So then just as the last note, we talk sometimes a lot, especially around youth, about how suicidal risk is maybe different on different months of the year that are perhaps aligned through changes around school and breaks and different other events that happen throughout the year. And so you're able to look at the data also breaking down by month. And so in this graph, we have grouped years together, 2021 through 2023. That just helps us to get a bigger group of cases to understand what is happening over a period of time. And so you can see that there is fluctuation. And so again, I want to refer to that very first slide where I talked about risk factors and protective factors. The data is a starting point. It is perhaps one of the first points that you want to look at when you're looking at data around suicide, but it is just a starting point. So if you want to understand a little bit more about what's happening there in September, I would encourage you to dig deeper into local factors that might be impacting your student populations during that time. Something that I didn't have a chance to say, and then I'm going to hand it over to Darcy, sorry, but I've shared all statewide information here, but you are able to break this down by county and by pre-designed geographic groupings, but you can also select multiple county groupings. And so especially for folks that are working in smaller counties, you are going to probably need to group yourselves both by years and potentially by multiple county groupings. And while everybody would prefer to probably look at their data in their specific county, it is a way of using data without perhaps being able to get a precise figure. So I want to thank you all. So much information, so much more I would like to share with you about this. Please don't hesitate to reach out to our shared email box. We love to talk to data with everyone who is interested in talking to us about it. Thank you.
Thank you so much, Melanie, and we'll drop that email address in the chat so that everyone has it. Real quickly, just wanted to share, next slide, please, that the Office of Suicide Prevention will be having our community of practice on September 24th. You can register for that at the link in the chat. That will be from 1 to 2:30 p.m. And we'll do a deeper dive on suicide and self-harm data, as well as expanding on that safe and effective messaging, and share a few more resources to use throughout the year. After this, it's just our appendices. Again, please take a look at that, pull from it as is helpful for all of you. Thank you for having us here today. That's it for OSP.
Thank you so much. I really appreciate it. And I wish the entire audience knew how many conversations and how you analyze this as one data point, but looking at multiple data points to get a really good picture of the communities, all the communities within California. Thank you both very much. I have the absolute pleasure of introducing to you a gentleman that I get to work with around mental behavioral health for our school communities. And that's Jeremiah Aha. Jeremiah is a licensed therapist and serves as Director of Communications for the California-based nonprofit Wellness Together. This is a conference that we do with the California Department of Education and Wellness Together. It's an incredible conference and an opportunity to provide best practices and current research and resources. Since 2000, he has served youth and families in community school-based and private practice settings. He is a California statewide suicide prevention partner and an original member of the California Department of Education Mental Health Collaborative. Jeremiah holds a master's degree from Asbury Theological Seminary and a master's degree in psychology from Brandman University. He is impressed you listen to all of this and lives in Sacramento, California with his wife and 2 daughters. Please join me.
Thanks so much. So glad to be here with you all. Thanks for all that have stayed up until the end of the time here. You'll be glad you did. I have 2 resources and 3 QR codes. 2 resources, 3 QR codes, and the last QR code you're really going to want to not miss. And just after I said that, I realized I sound like clickbait in human form, but I am serious. You're going to be glad that you stayed for that. Okay. Resource number 1 is going to be for your students 13 and above, and it's called Mind Out Loud. Before I tell you what it is, yes, I am biased, but there's so much great work that's being done across the state. So many things that we are creating and helping support our students and families in what oftentimes feels like an overwhelming need. And I would highly encourage you and advocate that you check out the resources that your county is offering. To be, quite honest, I think of San Joaquin County, shout out Nora, and what's happening with the Youth Mental Health Development Academy, things that are happening with San Diego County, LA. So make sure to check those out. It's great that we can be here to present all these resources to you, and Mind Out Loud is another one of those. So it is a platform where the mission is to amplify the student voice. Real quick, the origin story for Mind Out Loud is 2021. We're all locked inside. School is happening on laptops, on kitchen tables, and we're trying our best. And the CDE, as well as San Diego County Office of Ed, reached out and say, hey, can we put together an event for students? And to be honest, like, hey, in 8 weeks, can you do this? We said, we're up to the task. Let's see what we can do to amplify the student voice. As we're putting this together, we said it would be a disservice and an injustice to students if we said, let's do an event to say that your voice matters, and then we'll talk to you again in 8 months and we do another event. Let's make this a year-long program. So with the help of San Diego COE, CDE, Commission for Behavioral Health, and a couple years ago, Pinterest, we're an official Pinterest Purpose partner. I have to say it that slow to get it out. Really a year-long mental health advocacy platform has been born. You can go to the next slide, I can tell you what it's all about. This is a student-led initiative. So students have made these programming decisions. They have made even the decisions for what the 4 pillars are going to be. You can see here on the screen, number 1, we want to improve student mental wellness. Number 2, which is how this began actually, is to promote resources for suicide prevention. Number 3, we want to make sure that we're increasing mental health awareness and literacy. And finally, number 4, let's make sure that we are intentional about connecting students in rural and vulnerable communities. Let's make sure that the voices that are never heard or hardly ever heard, that those voices are heard too. And so what this looks like is a year-long program including student representatives, which are creating podcasts and blogs and social content. They're leading workshops. Mind Out Loud provides monthly free workshops for you, as well as an annual event. It's a really big deal for us. And use this as free resources, free content to go kind of hand in hand with your youth mental health club there at your site or there within your county. Let's go to the next slide. And when I say it's a really big deal, I mean it's a really big deal. This last year, we had over 11,200 students watching this free online virtual event. And we had some amazing guests, Juan Acosta, you'll see there, LGBTQ plus advocate, Rainn Wilson there on the far left, and really just shared their own stories and shared conversations on the impact of mental health on their lives and what it means to them now. These students were gathered in over 240 locations across the state and even across the US, where leaders at a site have said, hey, we'll provide some donuts and a screen. Students come here and watch this. We've called those watch parties since the first year. So if you're interested in hosting a watch party or interested in being involved for the 6th annual event, make sure to stay tuned on our website. The QR code number 1 was on that last screen. Let me put in the website here for Mind Out Loud. Click more to find out there. And let's go to resource number 2. We're halfway through, y'all. We're halfway through. Resource number 2 is the Wellness Together Conference. It is an absolute blast. Consider this a personal invitation to you. Many of you have been, many of you are registered, and if you're not, you gotta be there. It's happening at the end of September 29th to October 1st in San Diego. Shout out to the 619. And we're gonna have over 2,000 of leaders in mental health, education, policy, healthcare, technology. We're all gonna be there connecting with each other for 3 days of amazing keynotes and breakouts. We can go to the next slide. That's QR code number 2. Scan there to find out more. You can see that we're going to have the former US Surgeon General, Dr. Vivek Murthy, author of the book Together, as he really gives a prescription and the solutions for this loneliness epidemic that he's mentioned in his Surgeon General's advisory before he stepped down from being in office. You'll see a bunch of other great keynotes there. Anya Kamenetz, best-selling author. The Stolen Year was her latest book, where she talks about how this COVID year or how COVID affected our students. You see Dr. John B. King, the former US Secretary of Education, so many more. Make sure that you're there. And here's QR code number 3. I promised it would be worth it. QR code number 3 is on the next slide, and that is this news. It actually released today. We can go to that. We are extending 200 free passes for college students. Yes, absolutely free. College students can come to the event, 18 and up, as long as they're students in any major. Doesn't have to be school counseling or psychology or anything like that. Any college student, we want to be there because it is so important for us to expand and to diversify the mental health workforce, because representation matters. Because when a student sees someone across the room, across the table, that looks like them, that has grew up with them, that knows the same spaces there in the neighborhood, it really matters for them to be able to let their guard down a bit, to be vulnerable, enter into a space that is sometimes scary. So we want to fill that place with our college students. So scan that QR code. Let me put the link there if you're like on your phone. There we go. wellnesstogether.info/free college pass. Tell your friends, tell everyone, put that to your network. Let them know we're extending that. The news just released to, and thank you so much for letting me be a part of this great event. Shout out to you, Carrie, and the team. Any questions, hit me on email. There we go. There's my time.
You are an incredible presenter, just like you are when you were at the Wellness Together conference, which I thoroughly enjoy. I'm super excited to hear about students getting the passes. I was blown away by the conference and how well thought it is. And the speakers you have are phenomenal. So thank you so much, and thank you for your patience, Jeremiah. So I have another, I feel like I have the privileged job right here. And I just want to take a moment now to introduce our last speaker today, and that happens to be Dr. Suhail Sood. Dr. Suhail joined the Children and Youth Behavioral Initiative last year as the director. His background combines long-standing clinical experience as a pediatrician and an associate clinical professor at UCSF with collaborative public health work, serving as a key leader in the California Department of Public Health's Safe Schools Initiative and overseeing their school health and chronic disease programs. It's an absolute honor and privilege to share space with you today. Would you please join me?
Thank you so much, Carrie, and good to be with you all. You're in overtime, so I appreciate you being here. And hopefully you've learned a lot over the past several hours here from many fantastic colleagues doing amazing work. I'll just make a few points and then hopefully let you go on with your day. And we can jump to the next slide. I think that the first thing I really want to emphasize is that the landscape is changing. And for those that have been doing this work for a long time, and perhaps I think rightfully feeling like there's been an underinvestment or underemphasis on mental health, on substance use, on suicide prevention work, hopefully you're not just hearing that landscape is changing, but you're actually noticing differences in the resources at your disposal. And so the initiative I have the honor of directing, the Children and Youth Behavioral Health Initiative, really just honored to support and be part of those efforts. You can see the overall frame here, where we've essentially invested billions of dollars into programming that is hopefully making a difference in the lives of those children, youth, and families. You've heard some of those funded programs actually throughout this call. But if we jump to the next slide, just to bring it home a little bit, in any one county, picking on Humboldt for arbitrary reasons today, although they're wonderful partners, this is what the investment can look like, right? So we're seeing working with partners to build new physical facilities. We need more healthcare facilities to take care of kids in inpatient and outpatient settings. New partnerships, new training programs, and collaborations with institutes of higher education. Schools, don't need to tell anybody on this call, just the immense work that's happening to lift up different programs and increase access to services in schools. And certainly with many, many community partners in collaboration and holding hands, along with a lot of different digital resources as well. So this is the scale of change that's happening in any one county. And if you go to the next slide, what I really want you to take away, and I'll put this link in the chat right now, or Lacey's beat me to it. Thanks so much. What I want you to take away from this slide is this one specific link, which is that if you're doing this work on an island, find a buddy, build a bridge. There's so much that's happening in your community. This is a transparent database of institutions that we have partnered with at the Children and Youth Behavioral Health Initiative that are scaling up their services or increasing new work. So you can search, hopefully find a friend in your county that's doing the work already, and link arms because we are better together in this effort. So that's one piece. If we go to the next slide, I do just want to spend a moment touching upon some of the statewide resources that are really available in all counties. Hopefully these are not new words or names for all of you, but I want to emphasize again, they're all 100% free, all available in English and Spanish at minimum, with a telephone language support for 17 other languages for the two on the right here, for Saluna and Bright Life Kids. But just to go over them briefly, Mirror, again, it's a space to journal. It's a space to put down your thoughts. No one's going to read them. But what makes it different is that there's some adaptive tech features in the background that will summarize your entries, however unorganized you happen to be feeling, and it will spit it back to you in a way that may provide some insights and reflections for you to think about. It can also nudge you in the direction of support. Be that individuals you have identified as your support members, meaning your phone contacts, or in the direction of professionals, such as those available through Saluna or those available through 988. And so moving towards Saluna, again, this is a place to learn more and to connect to a professional. Cutting in sometimes the wait to see somebody from months to minutes. You can drop in as a young person in California, a very unique, privileged place to be able to connect to a professional and talk through issues. There's nothing that's too small to bring up to a coach through the Saluna app. And then also for Bright Life Kids. So that's for the parents and the younger kids out there with, again, no problem being too small, whether you're working through some playground drama or thinking about confidence issues, or even developmental issues. It's a great place to start that journey and to get some support. So that's one piece. If you jump to the next slide, a little bit more on some of our campaigns. Live Beyond, again, is a place to learn more about adversity in childhood, about ACEs, and to hear from young Californians directly from them about what they've been through, and as the tagline so rightly states, how you can live beyond that. So certainly increases your risk of long-term adverse health outcomes, ACEs do, but it doesn't define your destiny. I imagine many of on the call are familiar with Never Bother, which is the suicide prevention campaign really led by the colleagues you heard from, Darcy and Melanie at CDPH. But I also want to draw your attention to Positive Parenting, Thriving Kids. So these are 6 to 7 minute long videos about really common parenting challenges. I use them with my 3rd and 5th graders, really as trailers before we stream a family movie on our couch. So that's one way you could consider using them. And then on the far right here is Take Space to Pause, which is a place where you can find resources to have that first conversation about stress, where you can create a personalized pause plan and learn about how our bodies can really be activated to calm down in different ways. If you're looking for one resource to connect all of these together and to share out with your students and families, if you go to the next slide, here's a place where you can find them all in flyers that are available in English and Spanish. So I encourage everyone to share these out through your networks, through parent squares, right, peach jars, all the different ways that I know many of you communicate with your family partners. And then I will close with just a few other upcoming webinars. So if you want to learn more about a few different pieces, on the next slide is an upcoming webinar about the fee schedule program. So a big, very important landmark way that schools and their community partners are being connected to health insurance companies, right? So that we can pay for these services in a sustainable manner and that kids can continue to access them, if not more kids receive access to important school-linked services. So if you want to learn more about where that's at and how things are going and the next steps in there, this is a direct link. Sorry, it's lots of numbers and letters there, but a direct link to the team's registration for that. That's one piece. And then another piece is as we're working through services in schools and communities. We have to navigate through the laws that really allow us to share information, but also hold at the core the importance of confidentiality and maintaining privacy. And I'm speaking about HIPAA and FERPA. So the basically the privacy rules that govern the health space and the educational space, and this is where they come together. So to help navigate that intersection, my team and working alongside many colleagues have produced a toolkit that has several case examples, and alongside a webinar series, the first of which is on Monday, September 15th. So hopefully you can join us there. And then if you go to the next slide, I just want to share a message about the importance of the time you've just spent, from youth themselves. It's really important to get trained on suicide prevention. That life-saving conversation, life-changing conversation matters. So appreciate your time there. And I will close on the next slide with what I would describe as preliminary but very encouraging data from the California Healthy Kids Survey. So what you just heard from my colleagues at CDPH, from Melanie and team, was how to access data that relates to death by suicide. And that takes a while, right? That takes basically a review of coroner reports, of medical records, before that information gets to a point where it's cleaned and able to be shared out with the state. So because that takes a while, sometimes other points of data can be helpful in understanding how our kids are doing. And this is survey data. So this is talking to 7th, 9th, and 11th graders directly through the California Healthy Kids Survey. And on the left here, you can see that from really kind of striking peaks in 2021, less and less kids are noting that they feel depressed, essentially. The question that is asked for this chronic sadness piece is really close to the clinical definition of depression. And you can see that that is a very encouraging sign moving in the right direction. And similarly so, less and less kids are noting that they have felt suicidal in recent times. It's still too many, but there might be some signs that we are emerging from this fog. And if so, it is a result of all of you forming those connections, bringing both the heart and the mind into the spaces for those conversations with the kids and students and families that you work with. So thank you for your time, and I will pass back to you, Dr. Sakura. Take care.
Wonderful, wonderful. I always love sharing space with you, and I love the positive trend. I think it's really important to realize that we always look at multiple data points to get a better picture of what is the current reality of our school communities. And this brings so much hope, and there is so much hope. And you're here today, which means so much. We're going to have Dr. Boyer jump on and talk about some resources.
Hi, thanks, Carrie, and thanks, Soheil. As you can see, we are in overtime, and I just want to do a shout out and thank you to those of you who have stayed online. We still have well over 100 attendees, so I just want to thank you. And due to the sake of time, we did have some other presentations we did want to include, but we could go on forever and ever. So we're just going to drop the links here for you, but you did hear Dr. Sue talk about Saluna, and as well as San Joaquin. And again, it's a free app available to our youth ages 13 to 25. I highly encourage everybody on the call to share out the app. Again, it is free and it provides those resources for our youth, especially those who don't have access to immediate help. Also, you will see a link for Find Your Anchor. Allie Berkowitz founded this organization, and you may have met Allie in other webinars, but she puts together essentially boxes of hope that are geared toward youth or adults. She has some veteran boxes as well, but they include resources, cards, just essentially hope in a box that you matter. And she can provide those boxes to individuals, to school communities. Again, please check that out. And in addition to those two resources, we wanted to do a plug for mental health first aid, specifically youth mental health first aid. And you did hear Soheil talk about how important training is. And youth mental health first aid is free, and we want to thank Blue Shield for them contributing to us being having the opportunity to provide this training. So please, we will share out the link, but this is training for adults who work with youth. And we highly encourage you to reach out, find information about that. It is also included in our our weekly newsletters that we can include you in that distribution as well. Please let us know if you're not part of our listserv. We will add you to that. And again, these links will be in the toolkit, and we are in the home stretch. I just want to encourage everybody here, as you heard in the beginning and sprinkled throughout, take time to care for yourself. Practice your own self-care. Supporting others is important, but so is your own well-being. So please, please, please prioritize your self-care as you continue this journey together. And I'm going to hand it back to Carrie.
Thank you so much, Dr. Boyer, and again, thank you so much for your leadership on making sure that this happened in such a high level. An incredible job in facilitation of the webinar. So I'm going to jump this in real quick. For the Youth Mental Health First Aid, it is filling up very fast. We have 2 more dates left in September. Lacey put it in the chat, and then some upcoming October dates. We also do them for districts as a whole. So please reach out to the OSBHP office if you would like your district to receive that training. Since Blue Shield is sponsoring it, we know how valuable it is. But I'm going to leave you this one last thought. Remember, every child is one caring adult away from changing their narrative. Please be that one caring adult. Thank you, and have a wonderful day.